How to get rid of snoring. With age, almost everyone begins to snore and snore in a dream. However, for many, this problem occurs even in their youth and only intensifies over the years. Snorers are skewed 9-1 in favor of men, and 1 in 10 suffers from sleep apnea. Difficulties with night breathing do not allow the snorer himself to get enough sleep because of repeated awakenings, as well as family members because of the loud, unnerving sound. As a result, in the morning everyone is in a bad mood, drowsiness, irritability over trifles. How to get rid of snoring. Why is it important? How does snoring occur? Snoring is not an independent disease. In the ICD, it ranks among the unspecified symptoms of abnormal breathing. Despite this formulation, the pathogenesis of snoring has been studied quite well. In the waking state, when a person simply breathes and does not talk, the glottis is open for the free passages of air currents. At the same time, the tissues of the soft palate and vocal cords are in a state of tension. At the moment of phonation, extraction of sounds, the folds of the larynx vibrate, converting the exhaled air into a sound wave. The occurrence of snoring is characterized by a similar mechanism. The only difference is that during sleep, the glottis is noticeably narrowed, and the laryngopharyngeal tissues are completely relaxed. Hanging freely, when they inhale, they are sucked in with air inside, and when exhaled, they begin to oscillate, initiating specific sounds. The volume of the sound signal depends on the power of the head and chest resonators, the volume of the oropharynx, nasal sinuses, trachea, and lungs. In terms of frequency, the sound made by a snoring person is close to the upper limit of colloquial speech. However, the range may vary from person to person. Snoring is affected by congenital features of the larynx, pharynx, sinuses or lower jaw. Acquired structural changes in the oropharynx, nasopharynx, neck. Breathing features, speed, volume, turbulence of inhaled and exhaled air. Body position during sleep. Age, body weight. Snoring is included in the list of the main signs of sleep apnea syndrome, a sleep disorder associated with short-term pauses in breathing. The pathogenesis is due to obstruction of the air due to the displacement of the airways into the pharynx, pharyngeal collapse. It can be localized behind the soft palate, as well as at the level of the epiglottis. When the flow of air to the lungs stops, the level of oxygen in the blood drops, the concentration of carbon dioxide increases. In a state of hypoxia, the brain is forced to wake up in order to prevent suffocation and fatal outcome. OSA, obstructive sleep apnea syndrome, does not occur in all snorers, but constant snoring often leads to the development of OSA. Stages and types of snoring. According to medical criteria, snoring can be intermittent. It is characterized by periodic snoring that occurs due to temporary changes in breathing. Permanent. A person snores steadily in his sleep every night or at least 3-4 times a week. According to the severity of snoring is uncomplicated, simple or isolated, without stopping night breathing. Complicated, associated with OSAs. The second type of abnormal breathing occurs in 96% of snoring patients. Why do people snore? The etiology of snoring and sleep apnea syndrome is affected by natural triggers, not associated with abnormal changes in the upper respiratory tract. Anatomical factors, congenital or acquired structural features. Acquired dysfunctions or diseases. Natural, non-pathological, causes. Uncomplicated intermittent snoring is provoked by disorders caused by taking sleeping pills, physical overload, nicotine addiction, overeating, mental fatigue, alcohol intoxication, nasal congestion with viral infections or allergic rhinitis. Non-pathological causes also include incorrect head position during sleep. People usually snore when they sleep on their backs with their heads thrown back. In this position, the root of the tongue is displaced. This creates additional resistance for the free passages of airflow. To stop snoring, it is enough to roll over on your side. If snoring does not stop in the lateral position, this indicates a complicated manifestation of OSA. When falling asleep on a too high or very hard pillow, the neck is crooked in relation to the body, which leads to squeezing of the larynx, poor air conduction. Replacing an uncomfortable pillow with an orthopedic analog will help you find a restful sleep. Anatomical factors. Structural changes that cause snoring include hypertrophy of the nasopharyngeal or palatine tonsils. Congenital, traumatic deformation of the bone or cartilage of the nasal septum. Congenital malformations of the trachea, larynx, pharynx, tongue, nasal sinuses, underdeveloped lower jaw. Tumor or cystic formations of the upper respiratory tract. Long by nature uvula, palatine uvula. Traumatic brain injury associated with displacement of the bones of the skull or damage to the pituitary gland. A rare congenital cause of abnormal nocturnal breathing is a thorn-walled cyst located in the midline of the nasopharyngeal mucosa. Acquired pathologies. Snoring is influenced by chronic diseases of the upper respiratory tract, adenoiditis, tonsillitis, frontal sinusitis, ethmoiditis, sphenoiditis, sinusitis. Chronic otolaryngological inflammation is complicated by the growth of the connective and lymphoid tissues of the tonsils, palatine, nasopharyngeal. With sinusitis, polyps often form in the nose, and the permanent use of vasoconstrictor nasal drops leads to mucosal atrophy. Diseases of the endocrine system associated with weight gain, type 2 diabetes mellitus, obesity, hypothyroidism. They are accompanied by compression of the lumen of the larynx due to swelling of the visceral tissues and fat deposits in the neck. In such patients, as a rule, muscle reflexes, including those of the laryngeal muscles, are reduced, which, in combination with overweight, leads to impaired night breathing. Patients with vascular pathologies often snore. When blood circulation is disturbed, spasticity of the tissues of the heart, face, and lower extremities occurs. A similar process occurs with the tissues of the nasopharynx, oropharynx, and constant swelling prevents the normal circulation of the airflow. Gender reasons. In addition to the general causes of snoring, there are specific gender factors. In women, this is a change in hormonal status in the premenopausal period. During menopause, the functional ability of the ovaries decreases, the production of progesterone and estrogen, active participants in metabolic processes, decreases. Instead, estrone begins to be synthesized, stimulating the body to store fat. The result of a metabolic failure and a decrease in muscle tone is excess weight. In young women, a hormonal imbalance with all the ensuing consequences can provoke an incorrect intake of hormone-containing contraceptives. The predisposition of men to snore is due to the gender peculiarity of the structure of the oropharynx. It is naturally narrower than in women. In addition, the male anomaly of night breathing is often associated with bad habits. Nicotine addiction. Smoke constantly injures the mucous membrane of the respiratory tract. Toxins cause chronic swelling of the larynx pharyngeal tissues. Interest in alcohol. Ethanol relaxes the muscle tissue of the larynx, inhibits blood circulation and brain activity. In a state of intoxication, the respiratory function is disturbed. Wrong eating behavior. Overeating, passion for fatty foods, sweets is the right way to gain weight. The risk of developing OSA in men is twice as high as in women. Childish reasons. The leading etiological trigger for snoring in children is the adenoids. This is the name of the vegetation of the part of the lymphoepithelial-pharyngeal ring, the nasopharyngeal tonsils. Normally, the lymphoid tissue of the tonsils is an antimicrobial barrier that increases only during viral and bacterial attacks. After the pharyngeal ring returns to its normal state, too frequent, severe, complicated acute respiratory viral infections trigger a hypertrophic process. During sleep, the overgrown tissue falls into the throat, narrowing the lumen for the passage of air. In addition to adenoids, children are forced to snore. Allergic rhinitis, if not treated with antihistamine sprays or drops. Chronic diseases of the ENT organs, tonsillitis, sinusitis. Endocrine diseases, obesity, thymomegaly, thymus hyperplasia. Laryngeal-pharyngeal myasthenia, weakness of the muscles. Chronic snoring in children can develop into OSA. Age factors. As the body ages, the tone of not only the muscles of the body decreases, but also the muscles of the soft palate, vocal cords, and tongue. In addition, over the years, the functionality of the respiratory system decreases, chronic diseases, bad habits, and excess weight appear. Age-related changes in combination with acquired disorders lead to the development of night breathing anomalies. The danger of snoring. The appearance of snoring is more often observed when falling asleep, as well as in the phase of slow deep sleep, when the body produces the most important hormones for health. Melatonin, which regulates circadian rhythms. Somatotropin, which is responsible for tissue growth, strength of muscles, bones, breakdown of fats. Some sex hormones. Due to regular awakenings due to a lack of oxygen or at the requirement, of a sleeping person nearby, hormonal synthesis is disrupted. This leads to a decrease in immunity, a failure of thermoregulation and biological clocks, a decrease in libido, endocrine diseases, and early aging. The most serious threat to a snorer is the development of OSAs. Apnea episodes haunt a person all night, from 5 to 100 times per hour. With each respiratory pause, the snorer's brain is forced to wake up. As a result, a torn night's sleep turns into daytime weakness, lethargy, and drowsiness. A permanent lack of proper rest leads to the depletion of the body's resources. Complications of OSAs are cognitive dysfunctions, chronic hypoxia, heart failure, myocardial infarction, ischemic stroke. An exhausted brain may simply not wake up at the next stop of breathing. In the severe stage of sleep apnea, there is a danger of dying in your sleep. Snoring significantly reduces the quality of life of family members. It is impossible to sleep normally to the night accompaniment, therefore the spouses of snoring people suffer no less from chronic fatigue syndrome, neurological disorders, and hormonal disorders. Taking sedatives does not help well. Irritability, anger at a partner appear in interpersonal relationships, and sexual desire disappears. As a result, families are destroyed due to snoring. Diagnostics. Determining the degree of sleep disturbance, breathing, changes in the laryngopharyngeal structures is the task of an ENT doctor or a somnologist. The comprehensive survey includes the following activities. Collection of anamnesis, conversation with relatives. The doctor needs information about bad habits, chronic diseases, work patterns, lifestyle. In addition, it is necessary to establish the nature of snoring, frequency, intensity, presence, absence of apnea episodes. EEG, electroencephalography, with interpretation and conclusion of a neurologist. Conducted to assess the state of the nervous system, the functionality of the brain. Otolaryngological endoscopic examination. In conventional clinics, 2 studies of the mucosa of the ENT organs are prescribed, laryngoscopy and rhinoscopy. A more advanced method, nasopharyngolaryngoscopy, allows the doctor to assess the condition of the lumen and mucous membrane of the nose, larynx, pharynx and trachea in one procedure. X-ray of the bone structures of the skull. The photographs clearly show the anatomical nuances of the ENT organs. CT scan of the nasal sinuses. Polysomnography, monitoring the condition during sleep. While the patient is sleeping, the sensors located on his body take 18 indications of the control of the body. In parallel with this, the video camera captures the sounds, reactions and behavior of the patient during sleep. To identify cardiological, endocrinological disorders, consultations of specialized specialists are additionally prescribed. Treatment. It is necessary to treat snoring in a complex way. Strictly follow the doctor's recommendations, use special anti-snoring devices, take a course of PAP therapy. Treatment can be supplemented with folk remedies. Some patients require surgery. Recommendations. Treatment. The fight against nicotine addiction, independent or with the help of Nicorette. Refusal of alcoholic beverages. Dietary modification, exercise for weight loss. Purchase of an orthopedic pillow, it is possible with a grain filler. Daily exercise for the muscles of the soft palate, tongue, pharynx. Folk remedies. Alternative therapy is aimed at removing the swelling of the mucous membrane of the larynx and pharynx. Before going to bed, snorers are advised to rinse the nasal passages. You can use salt water or pharmaceutical nasal rinses. Drink freshly squeezed black radish juice seasoned with honey. Intranasally inject sea buckthorn oil 2-3 drops into each nostril. The nasal passages must first be cleaned with the spray. Carry out inhalations with essential oil plants. You can breathe over a decoction of eucalyptus, patchouli, bergamot, or add ready-made essential oils to hot water. Alternative methods of treatment are contraindicated in case of allergic reactions to the drugs used. Surgery. Surgical treatment is resorted to in case of progressive apnea or congenital or acquired anatomical defects. Operation types. Septoplasty, restoration of a distorted nasal septum. Polypotomy, laser destruction of polyps of the nasal mucosa or classical removal with a loop. Tonsillectomy, adenotomy, excision of hypertrophied tonsils. Uvulopalatoplasty, correction of the shape of the soft palate with partial resection of the hypertrophied palatine uvula. In advanced ENT clinics, an innovative method of compacting soft palate tissues is used, the introduction of palatal implants. The introduction of palatal implants. The introduction of palatal